Are you confused by what's happening as the Senate debates various healthcare reform proposals? Join the club. I read and analyze health legislation for a living, and I'm having trouble keeping up with the big and complicated changes in real time. Larry Levitt, a senior vice president at the Kaiser Family Foundation, tweeted on Tuesday night, as a series of votes began. On Wednesday, there were more votes, and there will be still more on Thursday, many of them, as the process climaxes in a so-called vote-o-rama. Many of these votes don't mean much. They concern Democratic amendments that have no chance of passing. But some of the votes are highly consequential, and two of them have already delivered significant setbacks to the Republican Party leadership. On Tuesday night, an amended version of the Better Care Reconciliation Act, Senate Majority Leader Mitch McConnell's proposal to repeal and replace the Affordable Care Act, was defeated, with 57 senators voting against it, including 9 Republicans. And, on Wednesday afternoon, a proposal to repeal Obamacare but put off a replacement for 2 years, which was McConnell's Plan B, was also defeated, this time with 55 senators against it. Much of the news coverage and commentary then began to focus on the last remaining big vote, on a so-called skinny repeal bill, which could take place late Thursday. Skinny repeal could be considered McConnell's Plan C, but before considering the details of this proposal, it is worth dwelling for a moment on what has already happened. Earlier this week, McConnell got senators to agree to start a floor debate without knowing what sort of proposals would be considered. This cynical tactic gave new life to the Republican effort to repeal Obamacare. The subsequent votes then represented an important victory for everybody who has opposed the Republicans' plans, and especially those who have sought to exert pressure on elected GOP officials. In failing to pass either a repeal and replace bill or a repeal-only bill, the GOP has publicly demonstrated that it's too fractured to turn history back to before March of 2010, when the ACA became law. The effort to resurrect the Better Care Reconciliation Act ran into opposition from ultra-conservative senators, such as Mike Lee and Rand Paul, who didn't think the bill went far enough, as well as moderate Republicans, such as Susan Collins, Dean Heller, and Lisa Murkowski, who are concerned about the slashing cuts to Medicaid that the measure contained. Then, in opposing the repeal-only bill, which would have created great uncertainty for tens of millions of Americans and chaos in the healthcare industry, 4 more moderates joined Collins, Heller, and Murkowski: Lamar Alexander, Kelly Moore Capito, John McCain, and Rob Portman. Taken together, these votes suggest that it is now highly likely that a good deal of Obamacare will remain in place. The unresolved question is just how much. If you believe the news reports about what the skinny repeal bill will look like when McConnell finally releases it, most of the ACA appears likely to emerge unscathed, including the Medicaid expansion, which has enabled about 14 million Americans to get healthcare. The Obamacare exchanges, where more than 12 million people signed up this year to purchase private insurance, the federal subsidies that greatly reduce the cost of these policies for low to middle-income households, the regulations that force insurers to offer comprehensive policies, the prohibition on insurers barring people with pre-existing conditions, and the taxes on the 1% that help to finance the system.